Yeah, that's a very innovative approach that we've started and launched at MD Anderson Cancer Center in Houston, Texas, which actually also has a conflict with the company because it's partly owned by us. So we have two abstracts this year. One is preclinical, which is actually showing the Tregs, which are CK0804 enriched, to home into bone marrow and then help with the inflammation, where actually came the idea to use this compound in patients with myelofibrosis. We ran the first study a couple years ago that showed promising and possible results in patients with MF as a myelofibrosis in terms of decreasing inflammation. So then now we combine it in the phase 1b study with Ruxolitinib. So patients, they are on Ruxolitinib and have suboptimal response in terms of residual symptoms or spleen or developing cytopenias, are allowed to be enrolled, and then they receive the CK0804 enriched Tregs by vein every month up to 6 times. And then we measure a standard responses in the response criteria as well as a safety. So far we've enrolled, as of a time of ASH deadline, 5 patients. Currently it's 8, so we are ramping up. And then we have been looking at how the responses might look like. So 4 patients had assessment at 12 weeks. And actually we have seen 1 patient with responses in their spleen, and then 2 patients out of the 4 with symptoms that would be standardized improvement in 50% of total symptom scores, and the spleen would be 35% spleen reduction by MRI or CAT scans. More importantly to me, exciting is these patients actually feel very good on the although it's infusion, they still like to come and are happy to receive the cells. They're more energetic. So we just have to continue with this and see how that's gonna shape the landscape of myelofibrosis, specifically for patients that have not suboptimal or they have not optimal response to ruxolitinib.